Manuela, one problem that we used to hear a lot about is smoking and tobacco. I know that's one of your areas of interest. Is there anything you want to kind of share about? Because I know people would probably like an update as to how we're doing on that.
Absolutely. So we're not doing very well. There are about 7 to 8 million deaths per year that are still attributable to tobacco. And in tobacco, unlike with obesity, there are success stories. So there are a large number of countries that have made tremendous progress. And we have really good measures that, if implemented, can actually lead to a reduction in prevalence. But there are also many parts of the world where prevalence of tobacco use, not just smoking, but other products as well, is increasing. And it's particularly disturbing when you look at the trends among teenagers and young adults, because those are the individuals that become addicted for life. And the rates among the young people are still increasing in many countries in the world.
I'm sure a lot of people watching this right now are curious to know, so what are the countries that are doing well in this area, and what are the countries that seem to be having a little bit more difficulty with it?
So some of the success stories that we have seen in tobacco come from countries that have implemented very aggressive tobacco control policies, and those range from Australia and Canada, but also include countries like Brazil, where in many parts of the country they have implemented bans on advertising and bans on smoking in public places and other effective interventions that work. Some of the parts of the world where we're seeing still remaining challenges are large countries. For example, China has a very high prevalence of smoking, particularly among men, but also countries like Indonesia, where young children initiate smoking, frequently under the age of 10, a lot of them under the age of 15. So we see a lot of parts of the world with large populations where the problem is still very urgent.